Hi, I'm Dr. Julie Steinauer. I want to talk to you about the hottest topic that we're seeing as a problem these days in our clinic. And I've done tons of video on this in the past, but I really honestly don't think I can do enough video about it. It just is prevalent so much right now. Strokes. So let's talk about strokes. Now, I did a video recently where I talked about a vision loss, and I want to discuss that today along with the strokes. And we're going to break down this vision loss, which is called a homonymous hemianopsia. And again, I've talked about this before in other videos, even one recently. But when I get called, emailed, and messaged about so far, 6 within 2 days just this week about these people who had a stroke and lost vision, it's kind of a topic we need to talk about more. So before we delve into that, if you want to contact us, call us at 618-288-1489 if you're local. If you're not local, go to our website at visionforlifeworks.com. You can either click schedule a consultation and consult with me directly about how I can help you, or you can click on the fill out a questionnaire button. That will kind of take you through a process, and eventually we'll start talking to you about maybe consulting with you online. Now, let's kind of go back. So stroke is a very hot topic right now. There is just a plethora of this going on in the world. And so people are contacting me from everywhere saying that they've had a stroke, they lost vision, what can be done about it? The most common kind of vision loss that we see after a stroke, but it is dependent upon where the stroke occurred within the brain. If it happens to be a stroke back here kind of at the base of the skull, which is like the occipital region, or if it occurs anywhere along in here, there's going to be some sort of an effect on vision. If it happens to be somewhere else, there can still be an effect, but it will be slightly different. And so a homonymous hemianopsia is what's most common. This is where a person has had a stroke, and as a result of the lack of blood flow and lack of nerve supply to an area within the brain, it tends to cause vision to be lost in a specific area. And in this case, a homonymous hemianopsia depends on where the stroke was. If it was on the left side of the brain, then there will be a right visual field cut. And so it's almost like if you want to think about each eye, here's a round eye, it has a visual field, we're going to cut the pie in half. No, we're not going to quarter it or anything fancy, we're just going to go in half for right now. In a homonymous hemianopsia, where it's a left brain, right vision problem would be like this area right here of vision is missing for the right eye, but it would also be missing for the left eye. Now, if someone had a stroke that occurred on the right side of the brain, it's going to be just the opposite. The homonymous hemianopsia could occur on the left side of the right eye and on the left side of the left eye. And this is debilitating. As you can imagine, just think about what would happen if you suddenly lost like half of your visual field for each eye. They run into things, they're unsteady, unstable on their feet. They can't see it. All of a sudden, it's missing, so they may even neglect certain things, feeding themselves, reading, driving, all of these things get affected greatly. And in fact, it can be a game changer, like, you can't drive anymore. Obviously, if half of your visual field is gone, you're not going to be able to drive. So there are conditions, again, depending upon where in the brain this stroke has occurred, there are also situations where instead of like cutting that pie in half, we're now going to quarter it, and there can be sections. So just like a quarter of the pie of your vision would be missing as a result of stroke. Now, here's several things to know about it. Yes, there is help. Yes, contrary to popular belief, you can do something about vision restoration. Yes, it is highly successful. Yes, it is important that it happen within a certain amount of time, but if years later you want to try to do something about it, you can have some vision restoration occur even years later. We highly recommend that you don't wait years. And the problem within this is that many times after stroke, depending again where it happened in the brain, there can be so many other modalities of treatment that are involved. There might be speech therapy, there might be occupational therapy and physical therapy because of motor weaknesses and speech problems. There might be, memory therapy going on because of memory issues, of forgetting lots of things. Almost like an amnesia, right? So there can be so many different kind of components of treatment modalities that are in the system after someone's had a stroke, that vision a lot of times is something that's like, you can't do anything, let's just see what happens if it comes back. That's absolutely not true. I tell people that's just silly. If you've had a stroke and you lost motor weakness on the started having motor weakness on the left side as a result of a right brain stroke, they're not just going to go, let's just see what happens. Let's just see if we can recover that. No, they put you into therapy to be able to improve the motor ability on the weak side. So at the same time, why are we not thinking of doing something to improve vision? They've got a loss. It's not true that that loss is just permanent and it's going to stay there. It is if you do nothing, however. So let me just show you a picture, and I talked about this in a video recently. This doesn't have any kind of identifying information on it, but this was a case of, if you can imagine, this entire side here before for this patient was all black, and over here it's white with little dots, okay? The white means that they can see all good in that area. This black means can't see. Now in this, you can see there are areas of white and there's also shadings of gray. This one is after having done our program, and this patient is still continuing to work to this day. So they are still working on a lot of the activities, even though their program ended. They've continued, and they kind of periodically come back and we give them some other tips to keep working on. And so I think now we're almost 2 years to 2.5 years post-stroke for this individual, but she has been highly dedicated. This entire thing before was completely black, and now vision has been gained back in this area, this area, this area, and there's some vision that is blurry and cloudy in these gray areas, but that means next those areas will come back. So what's most important? The area of vision most important for driving and doing things around is this area right here, this lower quadrant. So if you can do something to get that visual field area back, that's most important. Yes, we want this to come back too. Yes, that will affect driving and looking up, but mostly is this area right around in here with a lot of the things that we do. So this individual has had a crazy amount of change for the better. And what did we do? Now I know this video is getting kind of lengthy, but it's important to talk about these things, because if you've had a stroke, you don't want to just hang out there and wait. You know, the doctors are going to say, hey, just wait. Let's just see what happens in 6 months from now. Let's see if your vision's restored. What? You don't do that for speech. You don't do that for physical mobility. What? Don't do that for vision either. It's craziness. Okay, so what happens is we'll use a series of filters. This is the electrical stimulation part of the program, where we are electrically stimulating the brain to kind of heal itself, improve blood flow, increase nerve kind of conductivity, and it turns on blood flow and the flow of information to the areas of the brain that maybe the stroke obviously affected if it went without blood supply for a while. And so as we kind of replenish that area and help the brain go through restoration, that's how we can also help to restore vision. It is amazing. We've done it for this individual. We've done it for countless others. I can't even begin to tell you the number of patients right now that we have that we're working with who have had strokes and lost vision and have successfully gone about restoration of their vision. Well, now whether that's 20% or whether that's 80% of their vision that they've gotten back is highly dependent on several factors. And I'm going to give you some of those today. This video is kind of like all encompassing, but some of those factors are, if you're trying to do it all on your own without having a partner to help you, the partner to help you is actually the key. You cannot do this on your own. Here's the difference between the two. You do it all on your own. Right now, with the statistics that I have from our clinic of all of the patients that we've seen, you might gain back 20 to 30% of that visual field. Might. Okay, have a partner who helps you out with all of this and works really hard to help you restore your vision. you're going to go anywhere from 20 to 80% with your vision. That's just the way it's working right now. I'm telling you, it means everything in the world for you to have someone who's helping you work through this and helping you with restoration of your vision. Now, there is another factor which is highly important, which is your mindset, your attitude, your behavior towards all of this, your thinking patterns. Okay, all of that plays a part in this as well. And if someone's like, well, I just had a stroke, and they say that they just had a stroke, and they don't have the desire to do much of anything, and they don't think it's going to return, and they don't think they're going to get any better, versus the person who's like, no, it's going to get better, or they're going to die trying kind of thing. The don't give up, the stick with it kind of mentality. Super important. And again, we could lump those into, okay, bad attitude, struggling with the mindset, when we understand this is a life-altering event. A stroke is nothing to joke about. And if you've had that, obviously it's affected your whole life. It's turned upside down everything, your relationships, your finances, your job, your ability to drive, care for yourself. All of that has potentially been upset. But the person who has a partner, the person who doesn't have a partner and does it all on their own, maybe has a negative, mindset, is not very positive about the entire thing, versus the person who has a helper, positive mindset, absolutely going to recover no matter what. They're going to just do anything that they can. Huge difference. 20 to 30% maybe improvement, 20 to 80% improvement over here. Now, why do I say 20%? I'm always going to just be, judicious or cautious in what I'm telling you. Obviously, it's a case-by-case thing. We can talk with you more specific about it if you'd like to call us, 618-288-1489. Or if you're not, near us in the world, but you want to kind of manage this through your doctor, you can contact our clinic one of two ways. Go to our website at visionforlifeworks.com. Because we get so many requests every single day, we cannot possibly respond to all of them immediately. Sometimes it takes us an entire week to respond to you. If I get 15 requests in one day and I'm seeing patients and doing everything else, we cannot handle all of that volume all at once, but we will get to you as long as you're patient, I promise. So go to our website at visionforlifeworks.com. You can click on the questionnaire button, which is kind of answering some questions for us. We'll get some play back and forth with emails. Or if you want to schedule a consultation with us, click the button, schedule a consultation, and you can talk with me directly online about how we might be able to help you. Now, if this video has been worthwhile, it's been 13 minutes. If it's been worthwhile, what I would do is hit the like button, share it with somebody if you know it can be beneficial. Obviously, if you've not done so already, please hit that subscribe button and click the bell icon for all notifications, and that way you can be notified about all of our videos. Thank you.